Well documented as a botanical medicine for over 5,000 years, the discovery of endogenous cannabinoid receptors and evidence-based reports indicating the efficacy of medical cannabis for treating pain have renewed consideration of its therapeutic use. The past quarter-century's advances in healthcare science has included the discovery of a previously unknown human endocannabinoid system dedicated to maintaining critical balances between our mind and body. The following recording derives from a 6-part series of sequential lectures concerning endocannabinoid receptors and medical cannabis, as narrated by physician expert and author Dr. Jeffrey Block. This publication emphasizes how an appreciation of the biologic context to show how and why endogenous cannabinoid receptors function allows healthcare providers to better interpret the limited evidence-based data. In order to properly assess the abundance of anecdotal reports concerning cannabis, the safe and effective treatment of pain will require careful clinical monitoring of patient outcomes to establish and validate the evolving evidence-based data. Dr. Block is an American board-certified anesthesiologist and respected thought leader with a clinical scientist's understanding of the healing potential found with certain botanical medicines. Fellowship trained in both pain management and addiction medicine, his pragmatic rationale considers a citizen patient's compassionate access to the cannabis plant's bioactive chemicals when used for the treatment of pain, as well as acknowledging cannabis's obvious public health concerns ranging from contaminants to dependence. The author's insight shares contemporary perspectives by first acknowledging the bioethical obligation healers have to not simply feel compassion for their patients, but to strive to effectively treat pain. This is emphasized while at the same time acknowledging those concerns to public health surrounding addiction and accidental overdose deaths. Dr. Block's writing reveals how and why a human being's natural instinct nurtures their nature through their body's own endocannabinoids, and why a contemporary physician healer's understanding of the traditional ethnobotanical role certain plant-based medicines have played in treating the intolerable symptoms of disease appears to have also tangible value in modern healthcare. As read from Endocannabinoid Receptors and Medical Cannabis, here is the author Dr. Jeffrey Block's narration of Section 6, Contemporary Cannabis and its Medicalization.
Legal status and accreditable practice standards. Cannabis is undergoing a social process of medicalization, similar to what has been described with how contested illnesses come to be recognized as legitimate and within the domain of medicine. That process differentiates medicinal cannabis use from drug abuse and is reflected in the various medical access laws and institutional initiatives such as professional organization endorsements. Physician-led initiatives directed through the American Society of Cannabinoid Medicine provide responsible legislative guidance and leadership to advance high-quality education and clinical research. Physician-focused organizations, including the American Academy of Cannabinoid Medicine and the Society of Cannabis Clinicians, provide a basis through which contemporary practice standards are being established. Such standards of care are essential to assess and correct for negative patient outcomes. Accreditable goals will be essential to this emerging healthcare sector's ultimate success. Enforcing these practices through licensing dependent on accreditation will ensure continuous quality improvements benefits similar to the metrics used elsewhere in healthcare. The medicalization of cannabis is currently incomplete, but it is slowly being incorporated into physician education and practice and gradually becoming less controversial. Until then, as a Schedule I substance, cannabis cannot be legally prescribed anywhere in the United States. Federal courts have ruled that First Amendment protections of free speech cover doctor-patient communications, including the written recommendations required to participate in state medical cannabis programs. Doctors who recommend cannabis to their patients may experience heightened scrutiny from their peers, including state medical boards. These boards in states with medical cannabis programs have begun to develop limited practice standards for recommending cannabis. Those typically entail a physical exam and preservation of patient records, but minimal follow-up requirements to assess for patient outcome. Careful reevaluation is important to determine underlying conditions producing pain or other symptoms that may necessitate additional therapeutic or curative interventions. Cannabis can be considered as a complementary palliative medicine. However, at this time its recommendation should not be intended as an alternative medicine if that implies it to be a substitute for the evidence-based data essential to Western medicine's diagnostic and therapeutic advances. Guidelines vary between countries such as Israel and Canada that allow access via a physician's prescription. Health Canada has developed medical cannabis access regulations, and the Canadian Medical Association, the Canadian Medical Protective Association, and the College of Family Physicians of Canada have published practice guidelines for responsibly treating chronic pain and other debilitating illnesses. Future developments. At this time, whole plant preparations of cannabinoids and terpenoids produce multiple effects that are inseparable from one another. Future phytocannabinoid medicines may be developed which can exert their effects in isolated areas, including operating in the periphery on pain and other conditions without crossing the blood-brain barrier to include central effects. Developing methods of selectively inhibiting the psychoactive side effects of THC, such as increased synthesis of pregnenolone, may also enhance the versatility and tolerability of cannabinoid medicines. E-cigarette technology developed for nicotine delivery has recently extended to the systemic absorption of vaporized cannabis plant flower oils by utilizing so-called vape pens. While many vaporizers of cannabis are commercially available, devices that allow precise, consistent temperature control are ideal, as different temperatures will release varying combinations of these cannabinoid and terpene chemicals. Nevertheless, the black market operating within a largely unregulated vaporizing device industry currently appears to be responsible for increasing pulmonary deaths. These lethal complications associated with inhaled superheated carrier chemicals or contaminants will renew clinical interest in the dermal absorption of therapeutic lipids. Topical application and transdermal methods of delivery using nanoscale molecules such as liposomes improve the local site-specific and systemic delivery of the lipophilic cannabinoids and terpenoids produced by the cannabis plant. Nanotechnology can facilitate transportation of these drugs across epithelial and endothelial barriers, as well as extend their bioactivity and retention in the body to allow a more effective duration of treatment. Drug development may profitably focus on enhancing natural endocannabinoid system activity, but basic lifestyle adjustments are also likely to contribute to a healthier endocannabinoid system's response to stressors. That may be as simple as advising patients not only on the importance of exercise and sleep, which are both tied to endocannabinoid system function, but also on what to eat. Because the endogenous ligand anandamide and other important related lipids are synthesized in humans from omega-3 fatty acids, such as found in fish oil, dietary adjustments or supplements may also serve to improve endocannabinoid system function. The biosynthesis and degradation of enzymes such as fatty acid amide hydrolase and monoglyceride lipase that break down the endocannabinoids are prime targets for new drug development. Manipulating these enzymes may harness innate processes that counteract disease states, and plant-derived molecules such as cannabidiol hold significant promise for this. Allosteric modulators of endocannabinoid receptors other than CBD are a target of future drug development, as their effects on the receptor's activity can potentially enhance endogenous cannabinoid function. The 2019 case report of a woman who did not manifest anxiety or perceive pain as a noxious stimulus discovered that she had a pseudogene microdeletion compromising fatty acid amide hydrolase's breakdown of anandamide. Not unexpectedly, this individual's extraordinary phenotype also appears to cause other central nervous system side effects, including memory impairment. Future work will help to understand if targeting this link using viral short hairpin RNA or gene editing techniques could be effective as an analgesic or anxiolytic drug development strategy. Future therapeutic applications will eventually have less to do with the plant and more to do with other pharmacological ways to manipulate the endocannabinoid system. The contemporary clinician's responsible role. Clinicians recognize that pain can pose special challenges, and when intolerable, can drive patients to desperate measures. Seeking relief from the physical, psychological, or spiritual symptoms of disease is a natural instinct that contributes to therapeutic uses of many substances, including cannabis. Beyond the pragmatics of dealing honestly and directly with patient choice, the remarkable safety profile of cannabinoids can give clinicians an added measure of confidence in recommending it for patients who are not achieving adequate analgesia with more conventional treatments, particularly those who suffer from neuropathies and other intractable conditions. The complexity of the evolving legal landscape for cannabinoid medicines will continue to require attention, and physicians should act accordingly by first acknowledging that the treatment of intolerable symptoms to provide humane relief is a noble task that society bestows upon its healers. This imperative is perhaps seen and felt most acutely in the treatment of children. The suffering of children with seizure disorders has inspired parents, physicians, and policymakers to act on their behalf. The successful clinical trials of the first plant-based cannabinoid pharmaceutical medicine, cannabidiol, and its recent Schedule V designation have completed the initial steps towards making a more complete armamentarium available to physicians. Several other companies are following suit, and cannabinoids are likely to be featured in many pharmaceutical formularies of the future. The physician faced with a patient in intolerable pain has an obligation to not just feel compassion, but to do what is possible to alleviate that suffering without causing harm. As the limitations of opioid options become more evident, the search for safe and effective solutions has rightfully included cannabinoid medicines. Despite barriers to research, randomized clinical trials provide substantial evidence of the analgesic potential of cannabinoids that confirm animal experiments, laboratory science, and what is known about the purpose of the endocannabinoid receptor system. As clinicians consider how to apply these discoveries, they may do well to heed the ethical standards which physicians have historically promised to uphold, whether the Hippocratic Oath, to apply for the benefit of the sick all measures that are required, or that of Maimonides, to seek the strength, time, and opportunity to correct acquired beliefs and extend the domain of knowledge.
This recording has been a healthcare educational initiative read by physician-author Dr. Jeffrey Block. Dr. Block is the founder of Nurturing Nature Group Consultants, an independent and scrupulously neutral interdisciplinary consultancy group advancing endocannabinoid science through translational research within the practice of integrative medicine. To learn more, please visit nurturingnature.com.